Oh, you did my first one, yeah.
Oh, nice. That's good. Okay, can I just
Yeah, sure.
It's
okay.
The medical professional, are you, what you do?
Thank you.
Done.
Great.
I've just been told that it is, I am receiving the vaccine. There's a small group of people at the start that receive the vaccine to be checked on any reactions, effects, but as far as I'm aware, everything's going okay, everything's fine.
MCB 0520-8.
Before the lockdown, I was very much had a mask. I was washing my hands. I was being safe with where I was going, and just watching the news reports and what's happening. And even now, it's just carry on as normal the best you can, and there's no difference to how I behaved last time, apart from masks, washing your hands, performing cues, more cues than normal. I think even knowing that I've got the vaccine doesn't make any difference to the fact if it was a placebo, if that makes sense. I'm just taking part, so.
I'm going to just check again. When you feel your arm just getting numb,
No, I'm okay.
Everybody has seen the statistics around how COVID has affected BAME communities, and I think it's really important that as a team working on a vaccine that we respond to that. So far we've been really pleased to have support from our local community, and amongst our volunteers 1 in 5 are from a BAME community, which is really great and is representative. And what we want to do as we build our research and go forward into larger trials is to continue getting that support.
Yeah, just too much.
I don't think we're targeting specific communities. What we're trying to do is to make vaccine research available for everybody, so that when we have a data set that we're looking at in order to understand if the vaccine is performing as we think it is, that we're able to do that in a way that is then generalisable, so that people can be vaccinated as part of a public health campaign.
No, it's fine. It's okay.
so you're going.
No, that's fine. I go home via Oxford Circus, so I won't today. I'll just go straight home.
It's very clear that more severe disease is seen in older people, but we don't yet know why, and I think that's also the same for the BAME communities, and it's very important that we do take a dispassionate approach to that, and one that allows us to understand the problem and then we can deal with it.
Because I'm working home, so it's something that I'm doing very frequently. That's something.
Oh yeah.
We've heard from so many of our participants how COVID has affected their lives, often in very difficult ways, and from the many people that we meet as part of the vaccine research, many more than we were able to enrol on the study. And I think that personal experience will certainly change people's understanding of infection, and also how it's prevented, vaccines being a very important strategy.
So relax. Shout and I can see his response, or?
Yes.
Sorry.
Do you want to start with the name and?
Yeah.
I saw how serious it was, so it was a serious thing, and it is still a serious thing. So I won't go out my way, but I'll also follow the rules, if that makes sense. So I think it's, if you're comfortable with it, do it, and I'm comfortable with what I'm doing now. And if it comes to later in the year and there's another lockdown, or I have to change my travel, or I have to change my visits, I won't be going away this year. There's no holidays booked. There's no anything. It's all just do when it can be done, really, for me at the moment.
It's 5 p.m. starts,
It's fine.